So let's begin with a visit to the internet. If you're computer savvy, you probably already have a sense of the many things you can now do and learn via your computer keyboard. The World Wide Web is the internet resource where most of the available information lives. And today, you can find many sites on the web containing information on medicine and other aspects of healthcare. But just as you shouldn't agree to surgery without knowing that your surgeon is qualified to operate on you, you shouldn't trust medical information that you find on the internet without knowing that it comes from a reliable source. So here's a story that will help you tell the good information from the bad.
As seniors explore the vast trove of information that's available on the internet, many are discovering that it contains a great deal of advice and data on health issues. Experts acknowledge that the net is a helpful tool, but they warn that it should be used with care. Helen Helm began researching medical websites when she was first diagnosed with cancer. She was motivated by anxiety about her illness.
It was something I knew nothing about, and it scared me. So I got on the computer, I looked up, put the word cancer in Google. It gave me information that I could then talk to my doctor about. It helped me understand a little bit better what my doctor was trying to tell me.
As Helen found, the web contains a wide variety of medical information. She quickly made her way to the website of the National Institutes of Health, or NIH.
I went to the NIH Senior Health site and looked up cancer. They have a directory there. And I found a lot of definitions and pictures and what it looked like, but I also found some very good information about the treatments and what I could expect when they said terrible words to me like chemotherapy.
Lauren Archer teaches people to evaluate and use medical websites. He says that Helen's first choice was a good one.
NIH seniorshealth.gov was an excellent website to start with. Provides wide range of information, assistance, and is specifically designed for individuals 60 years and older.
Archer warns, however, that not every site can be trusted. When trying to determine if a medical website is reputable, ask the following questions. Who is the site sponsor? Is the information referenced to a reputable source? What studies are quoted, and where can they be found? Has the information been validated with an editorial review? Will my privacy be protected?
You should be concerned and aware of how they're going to use the information that you give them.
Helen Helm was fortunate to have a doctor who coached her on choosing reliable websites.
He warned me to stay away from sites that I didn't know anything about. He told me to stay with recognized sites. He also recommended a few other specific hospital sites that he knew about.
The doctor's role in this is to assist you to become more knowledgeable. And in many cases, it's well to print out information that you've acquired, bring it in, and ask him to evaluate it. He can evaluate your situation much better.
I think having information like this made it easier for the doctor to explain to me what was going on. So when he told me, this is what we're going to do, or this is why we can't continue today, why we have to stop, I understood what he meant. And it took away a lot of the frustration, it took away a lot of the fear. And I think being less afraid of the process eased it a great deal, and I think it made it more effective.
Also available on medical websites is information on medications and alternative therapies.
I've had some difficulty with some medication, and my doctor changed it, gave me something new. I had never heard of the new medicine, looked it up, found out what it was, checked into the side effects and after effects, and looked at some other things that were also being recommended as an alternative to those medicines.
Some medical websites have been specifically designed to be senior-friendly.
A website feature that's quite useful is the ability to change the contrast so as to make the text more visible, the ability to change the size through increasing the magnification, or a feature which is available on many sites, which is to use your cursor and have the text read to you. Video tutorials are an excellent tool which is available through the internet, and they provide short video segments giving graphic details and information in an easily understandable form.
The resources available on the internet can be a wonderful remedy for seniors' healthcare questions. But as Helen Helm has learned, they're not a cure-all.
I find the information that I have gotten on the internet has been most effective in helping me discuss things with my doctor. It works with the doctor, not in place of the doctor.
Here with me to discuss the upside and the downside of the medical information that's on the internet are Dr. Michael Smith and Alan Spielman. Dr. Smith is the medical editor-in-chief of WebMD Health, a popular medical website. He holds a medical degree from the Mercer University School of Medicine in Macon, Georgia. Alan Spielman is president and chief executive officer of URAC, an independent nonprofit organization that accredits and certifies healthcare websites and other services. Mr. Spielman holds an MBA in healthcare marketing from Loyola College. Welcome to you both. Thanks for being here.
Thank you.
What is URAC?
Well, URAC is a nonprofit independent healthcare accrediting body.
And what do you do?
Well, we set national quality standards using national experts, and then we send teams out to evaluate, to kick the tires, to establish that the companies are complying with those standards. So we evaluate HMOs, PPOs, and a number of important healthcare websites.
How do you decide which healthcare websites to look at?
Well, that's a good question, and it's important to realize that URAC accreditation is voluntary. So a healthcare website would come to us seeking accreditation to show the marketplace and consumers that they meet the quality standards.
So, Dr. Smith, you're with WebMD.
Correct.
Have you been URAC accredited yet?
We have been.
And how did that make a difference in the way that your audience or those that looked at your website have appreciated what you do?
Absolutely. I mean, so the fact that we do uphold to URAC standards really says a lot about our policies and that we're really providing information that's helpful for our users.
What are a few of those standards?
Well, we have a number of standards related to privacy and security of information, disclosure, whether or not the source and the ownership of the site is disclosed. We have information and standards on authorship. Is the author of the content described, and is the date the material was reviewed or developed clearly indicated?
Dr. Smith, why do you think this kind of accreditation is important?
Well, it's really important because the internet is so highly used for health information today. And the fact that we're able to provide users with credible, reliable information is really vital because that's what they're taking into the doctor's office. That's what they're really using to base all their medical knowledge on. So,
what kind of research, though, actually goes into the information that you provide?
well, all of our information is evidence-based so that we come from medical journals, conferences, medical conferences of specialists. All of our information comes from medical organizations, health organizations, American Heart Association, for instance. So it's based on good, solid evidence.
When I was researching this, there was the greatest term that I heard about, cyberchondria.
Right.
What is cyberchondria?
Well, it's definitely an internet phenomenon in the fact that there is so much health information out there. People come across all types of information, and they tend to sometimes overdiagnose themselves, and that can lead to problems.
So how do you think that patients should actually use medical information from the internet?
Well, one of the best and simplest ways is simply to print out the key information that you've gotten, take it in with you to your doctor's visit, and discuss it with your doctor. I think that ultimately is the best source.
But talking about cyberchondriacs, if you will, how do you get past that doctor-patient relationship when they're coming in armed with the whole medical journal?
Well, the good thing is, let's take 7 years ago. I think doctors were more intimidated about health information on the internet. Today, they're very open-minded. They know that there is good, credible, reliable health information out there. Patients need to make sure they're going to those good, credible sites. And the physicians today do welcome that information because it helps expedite the small amount of interaction time that they have with their patients.
And just before we take a break, the information that you have online, how do you make sure that it's up to date?
Well, that we put everything through a regular medical review process so that every year or two, everything is medically reviewed, making sure it's up to date, in line with current clinical medical practice.
Very interesting.
And that's one of the key aspects of URAC accreditation.
Okay.
Does the site regularly review the material?
Great.
Right.
Hold that thought. We'll be right back in a second. It's time for us to take a short break, but we're going to be back shortly to continue our discussion about medical websites with Dr. Michael Smith and Alan Spielman.
Do you know? What percentage of a person's knowledge comes from vision? A, 65%, B, 85%, or C, 90%? Do you know the answer? It's B, 85%.
Welcome back to the Daily Apple. We're talking about the medical information that's available to you via the internet with Dr. Michael Smith, Medical Editor-in-Chief of WebMD Health, and Alan Spielman, President and CEO of the nonprofit organization URAC. Before we went to break, we were talking a little bit about keeping medical records up to date that are, or not medical records, but medical information that's on the internet. URAC plays a part in that?
Well, absolutely. And seniors need to realize that the internet is, it's like a wild, wild west out there. Absent URAC accreditation standards, there are no national bodies that regulate the content of what's on healthcare websites. So a company coming to URAC for accreditation, they've made a commitment to making sure their content is up to date, making sure that they designate who actually was the author. You know, and if a senior sees a website with a lot of good information, but the site is unwilling to disclose, well, where did it come from, who wrote it, then the question mark should be risen.
And that's an interesting observation. So they should look at the authorship, number one. What other things should people look for when they're trying to find a legitimate website for medical information?
Right. They should definitely make sure that the source material is there. Where did the content come from? Did it come from medical journals, conferences, health organizations, government websites? That really should be listed so that they know it's coming from credible, reliable source.
You know, not to get too personal, but when I was researching some information of a family member who was diagnosed with cancer, I read a lot of blogs and I read a lot of sort of personal anecdotes. And to be honest with you, I found it incredibly helpful. What are your thoughts on blogs and sort of the customer or the end user writing medical information?
Well, they certainly can play an important role, among other things, in connecting people with others that have similar diagnoses. I think the key thing would be not to look to them for definitive medical advice. I think there you want to make sure you're, what we say is follow the money. Go to a site that you know who is sponsoring the site. Is it a government institution, a university? Many very qualified commercial sites. Who is sponsoring it, and look, among other things, do they have a URAC seal of approval on that site?
You bring that up, government institutions, NIH, National Institute of Health. What are some other credible sort of marks or logos they should look for?
Well, there's the trustee logo. That's another good one.
Okay.
And what they really want to do, though, the most important thing is to read the website's privacy policy in addition to looking for those accreditation stamps, because that really plays a big role in health information, because they may be asked to provide personal health information, and you really want to understand how that information is going to be used.
So we know what to look for, but what are some of the warning signs that a website's not on the up and up or a bad website?
I think the biggest thing really is that the content is not clearly labeled. And what I mean is the senior may not be able to really tell if they're reading something from an advertiser or are they reading something from the company's editorial department. Everything should be clearly labeled advertisement or coming from the... And in addition, the sources, I think, are really vital information, because otherwise you don't know where it's coming from.
And this point on advertising, that is in fact one of the URAC standards, to make a clear delineation between what is medical content and what is being sponsored by an advertiser or what is literally a product advertisement.
But along those lines, obviously there has to be a revenue model, and if advertisement is a little iffy, what do you think about memberships online for websites?
Well, and don't get me wrong, advertising is not iffy as long as it's distinguished.
Okay.
So I think that that's fine. And membership models, well, you know, most people who are members of health plans are members of those organizations and those health plan websites which enable people to check the status of claims, get medical information, get benefits information, are very valuable. I think the key thing is just to be aware of what membership organization are you joining. When you look at separate sites that aren't related to your health plan, the key thing would be, as Michael says, look at the privacy policy and don't give any private information unless you know it's going to be protected.
I want to touch on that. So you look for HTTPS, and the S means that it's a secure site. Is that correct on the URL? Is that if a person wants to give medical, or if it's asked for medical information, how does the person know that that's a secure site?
Well, again, going back to the URAC accredited sites, you know, we require the companies to do routine security evaluations.
Okay.
But I can't speak to the URL.
Well, it's HTTPS, and that means it's secure, but also the URAC logo, you're saying that it's encrypted and the information. What about editorial review? What do you mean by that?
Well, what I mean by that is the annual or biannual medical review of the content to make sure that it's up to date. Is it in line with current clinical practice? Is the information that the reader is looking at, is it going to be consistent with what their doctor is expecting them to read? So that's why we annually or every 2 years make sure that a physician, at WebMD we have board-certified physicians look at this content regularly to make sure that it's in line with clinical practice.
Now, WebMD, does it also have some Eastern medicine ideas that are embedded in some of your content at all, or is it all Western?
No, we absolutely cover complementary medicine. It's a big part of what users want to read. It should really fit the same standards. You need to know where the source information comes from. Make sure it's coming from experts in the field. Make sure it's coming from credible health organizations, studies, etc. It really needs to meet the same criteria.
I want to go back to a subject we touched on for a minute earlier. It's a huge challenge between the patient and the physician in terms of sort of bringing in all this information. Tell me some tips that you think the patient can take to heart when they bring the information, and quite frankly, a physician as well can take to heart.
Well, certainly the consumer, the reader, is going to read a wealth of information. You don't want to copy all that and bring it into your physician. That won't help the conversation. The purpose of the content that they're reading is to help them make better informed healthcare decisions in cooperation with their physician. They should never use the information to make decisions on their own. It's to help them work with their physician. That said, what they need to really do is print out the most important information. Did something they read spark a question? Print that out, bring it to their physician. For instance, at WebMD, we have 10 questions to ask your doctor. If you're diagnosed with a condition, these are 10 questions you want to know more about.
Does your doctor give you enough time to ask 10 questions these days?
These are very straightforward.
And I come from a medical family. I mean, I'm telling you.
Straightforward questions. So to really better help them, for instance, someone has diabetes. Better help them understand their particular circumstance with their diabetes.
What concerns me a little bit, though, let's say you go to several URAC websites that are approved by URAC or accredited, but they have contradictory information, say, about how to treat diabetes. What do you do at that point?
Well, I mean, that obviously creates some challenges. I think what we see in most searches that people do, they often hit multiple sites. So there, I think, as Michael said, you really need to sit down with your doctor to sort through that. One guide would also be to look at the date in which the material came up. Maybe it's not really a contradiction, but somebody has more up-to-date information, and we know that the medical field is constantly changing.
Sure, that's a good observation. What about senior-friendly websites? Clearly, text and font is important. What other things do you actually make a part of your website that makes it more senior-friendly?
Well, the font is a big one. Anything that helps them more easily read the content, because that is a challenge on the internet. I mean, it's typically small letter, and it's difficult sometimes for them to read. We also provide content that's specific to that age population. For instance, our Medicare channel. It really helps a very challenging area of medicine for them to understand, especially these days, really providing them focused information to really help them understand the issues that they live with on a day-to-day basis.
That's fantastic. And what about individuals that feel that your website is actually not giving them the information that they need? How do you respond to that kind of criticism?
I'm not sure I follow your question.
Well, if there are seniors that want more information about certain areas or certain subject matters, are you guys open to suggestions on certain topics of conversation?
Absolutely. We always welcome feedback. We get constant feedback from our readers, welcome it. It really helps the department. I head up the content department. It really helps us really focus our attention on where we need to expand our content to help answer more questions for our users.
Yeah, that's fabulous, because I know a lot of viewers will probably write in and ask you for additional information on certain areas. Thank you so much.
You're welcome.
Great to have you both here.
All right, thank you.